Dealing with burns is difficult because they can damage the structure of the skin and impair its ability to function. Burns can impair the body's fluid and chemical balance and body temperature regulation, as well as its musculoskeletal, circulatory, and respiratory functions. Burns are graded on the basis of tissue damage. There are three types: superficial, partial thickness, and full thickness. A superficial burn is a first-degree burn. It usually only involves the epidermis. Commonly seen with sunburns, are caused by heat, flames, hot liquid, or prolonged sun exposure. The skin will appear pink to red and will be dry. There may be slight swelling, but no blisters. A partial thickness burn, or a second-degree burn, involves not only the epidermis, but also the lower layer, the dermis, as well. A partial thickness burn will appear white to cherry red. It may be moist if the epidermis is violated, and it may look mottled. There may also be blisters on the skin. These burns are extremely painful. A full thickness burn involves all the layers of the skin and can extend into the muscle, bone, or organs below. The skin will become dry, hard, tough, and leathery, and may appear white and waxy to dark brown or black and charred. As a first aid provider, it is not important for you to determine the seriousness of the burn. Your first responsibility is to remove the patient from the source of the burn and stop the burning process.
Wow, that's okay. Look, just relax. I know it hurts. Just relax. I'm going to pour some water on it.
You can stop the burning process with water or saline, but do not keep the injury immersed.
Try to cool the burn down a little bit.
If the burn was caused by a semi-solid or liquid, such as tar, grease, or oil, do not attempt to remove the substance. You should immediately assess the patient's airway, breathing, and mental status. Pay particular attention to any signs that the patient may have inhaled smoke or flame and caused damage to the upper airway. If so, you should maintain the airway and provide supplemental oxygen. If the patient is not breathing adequately, support her breathing.
All right, hold on. Let me try and get some help on the way, okay? Hold on.
After you have stabilized the patient, cover the burned area with a dry, sterile dressing. If the burn is localized to a small area and mild, you may apply a topical antibiotic ointment or Silvadene. For more serious burns, cover the injury and seek appropriate medical care. Do not break blisters, as this may cause further contamination and potentially cause fluid loss. You should also continuously monitor the patient and treat for shock if any signs of that condition become apparent. It may sound odd, but keep the patient warm. The burns may have impaired her ability to regulate her own body temperature.
Hold on. Stay with me.
If the burn is on a finger or hand, remove all jewelry. These can cause constrictions if the injury site swells. If easily separated, protect the fingers and toes from each other with sterile dressings. If the burn was caused by a chemical, flush the eye with water for at least 20 minutes. This is crucial for alkaline substances.